Good afternoon, everyone. We're thrilled you've joined us today for Nutrition and Bone Health Across the Lifespan. We're waiting just a few more minutes to allow all our participants to join, and we'll get kicked off shortly. We're going to wait just a few more seconds, and then we'll get started. Just want to make sure all our participants have a chance to join. All right, well, good afternoon, everyone. I'm Sally Cummins, and I'm the Vice President of Scientific Affairs and Outreach at National Dairy Council. And we are thrilled you've joined us for today's webinar, Nutrition and Bone Health Across the Lifespan. Before we get started, I have just a few reminders. The chat function has been disabled for this webinar, but please type any questions you might have into the Q&A box. And periodically, you will see a few links to resources pop up as well. If you're sharing what you're learning on social media today, please use the hashtag Dairy Nurses Life. And if you have any technical difficulties, you can visit Zoom for support. Now, after the webinar, I know you'll all be looking for your continuing education certificates, and you'll receive those when you complete a short post-survey evaluation that pops up at the end of the webinar. And also, a recording of the webinar, as well as any related handouts, will be posted on usdairy.com next week. You know, it's been said that osteoporosis is a pediatric disease with geriatric consequences, as children, teens, and young adults have a unique window of opportunity to build bone density. But unfortunately, 1 out of about every 6 Americans is affected by osteoporosis and low bone mass. In fact, in the US, more than 2 million broken bones are caused by osteoporosis each year. And while we might typically think of long bones and hips when we think bone health, the reality is not only do bones support your body and allow you to move, but they protect your brain, heart, and other organs from injury. The good news is osteoporosis is largely preventable, and I'm thrilled to be joined today by Dr. Taylor Wallace. Dr. Wallace is an adjunct professor in the Department of Nutrition and Food Studies at George Mason University and the CEO of the Think Healthy Group. He has served as the senior scientist for both the National Osteoporosis Foundation and National Bone Health Alliance. In addition, he is a senior fellow for the Center of Magnesium Education and Research, the editor-in-chief of the Journal of Dietary Supplements, the deputy editor-in-chief of the Journal of American College of Nutrition, and the nutrition section editor of the Annals of Medicine. He operates the popular food and nutrition blog, www.drtaylorwallace.com, and is co-host of the weekly radio show, Risky Behavior. And you may have seen him as a regular guest on the Dr. Oz show. Dr. Wallace has received a PhD and Master's of Science in Food Science and Nutrition from The Ohio State University and a Bachelor of Science in Food Science from the University of Kentucky. And with that, I'm happy to turn it over to Dr. Wallace.
Well, thank you, Sally, and thank you to the National Dairy Council for having me today. This is a topic that I am super passionate about, as I have a history of osteoporosis in my family, which we'll talk about as not just a female disease, but is very concerning among men as well. So today we're going to cover the bone biology, bone development and maintenance, bone building nutrients, dietary patterns and food groups that all influence bone health throughout the lifespan. And then we'll jump into some other lifestyle factors and leave you with some concluding remarks. So it's always important to be transparent and declare your perceived conflicts of interest. So you can see my current employment with my own consulting firm, Think Healthy Group, and journal editorships and research funding that I've received within the past 3 years. All of my conflicts of interest can be found on my website, drtaylorwallace.com. And this presentation was developed and continuing education credits provided through an educational grant from the National Dairy Council. Although the funder did remain hands-off, the content of this presentation is that that was developed by me alone. So this is my scientific perspective. Okay, let's jump right into bone biology. There are three types of bone cells. One, osteoblasts, that are responsible for bone formation. The second type of bone cell is osteoclasts. They're responsible for bone resorption. And then the third type of cell is an osteocyte, which is a mechanosensory cell that controls the activity of both osteoblasts and osteoclasts. And you can see, graphically what these different types of cells look like to some extent. Now, bones are comprised of two types of tissue, cortical bone and trabecular bone. You can think of cortical bone as compact bone. It's usually the hard outer layer. It's very strong and dense. If you think about your long bones, they contain a lot of cortical bone. Trabecular bone is the spongy inner layer network of trabecula. And you can see the trabecula bone to the very right of your screen. It's lighter and less dense than cortical bone. There are two main types of bone, woven bone and lamellar bone. Woven bone is a haphazard organization of collagen fibers. This is mechanistically weak. It's produced initially when fetal bones, and it's replaced by remodeling and deposition of more resilient lamellar bone. In adults, the only real time that you see woven bone is when there's a fracture. Woven bone is then remodeled into lamellar bone to make that bone, strong once again. So virtually all bone in a mature, healthy adult is lamellar bone, is woven bone. Lamellar bone, like you might have guessed, is characterized by a regular parallel alignment of collagen into sheets, and it's mechanistically strong. And again, this is the predominant type of bone in adults. The bone matrix is comprised of 25% organic matrix. Remember, organic means it contains carbon. 2 to 5% of this 25% organic matrix are cells. So remember, we went over our three main bone cells. 5% of bone is water, and about 70% is mineral. The organic matrix is comprised mostly of type 1 collagen, about 94%, and there is some other non-collagen proteins also in the bone matrix. The hardness and rigidity is due to the crystalline complex of calcium and phosphate, and we know this as the hydroxyapatite crystalline form. And if you actually take a bone and you put it in acid, it will dissolve away the minerals like calcium and phosphate, and you'll get this little jelly-like formation, and that's the collagen. So you can think of collagen as the glue that holds those minerals together. So bone modeling is when bone resorption and bone formation occur on separate surfaces, and this happens throughout our lifetime. This occurs during birth to young adulthood and is responsible for gain in skeletal mass and changes in skeletal form. So you'll see bone modeling occur very early in life, where bone formation exceeds bone resorption. Later in life, you'll start to see bone resorption increases and bone resorption or bone formation isn't as adequate. So bone remodeling is the process of coupling between bone resorption and formation that maintains adult bone mass. Replacement of old tissue by new tissue continues throughout life, and the adult skeleton turns over about once every 10 years. So your body is constantly breaking down and building back about 10% of your skeleton every year. And that's really what keeps your skeleton strong and viable. The musculoskeletal system This is what we're really worried about. We often, in medical fields or even in nutrition, we like to think of things in isolation, but bones, muscles, and joints are all an integral part of the body's musculoskeletal system. So problems with any one component of the system obviously can affect the other components. So for instance, if you have sarcopenia or muscle wasting, you're more prone to fracture because you would fall or you're not as strong. All of these parts of our body work together. Now, to my favorite part, bone development and maintenance. So during growth and development, skeletal growth proceeds through a coordinated action of bone deposition and resorption to allow the bones to expand. And this is called parastesial apposition of cortical bone. And you can see the figure to the right of your screen. This is how bones grow and get to their adult stable state. The epiphyseal plate is the area of elongation of the bone. You see that in red to the right center of your screen. The process of bone modeling begins during fetal growth and it continues until epiphyseal fusion, which is usually by the end of the second decade in life. And we'll talk just a little bit about peak bone mass acquisition in just a moment. So peak bone mass is the amount of bone gained by the time a stable skeletal state has been attained during young adulthood. And this peak bone mass differs by bone site and it differs by individual. The definition more broadly captures peak bone strength, which is characterized by mass, density, microarchitecture, micro repair mechanisms, and geometric properties that help provide structural strength to bone. Peak bone mass is attained when age-related changes in a bone outcome are no longer positive and they plateau. So you can see in the picture to the right of your screen, the age at peak height velocity and the age at peak bone mass can fairly differ. You can see that it's different among girls and boys, and we'll talk in just a minute about genetic differences in peak bone mass attainment. So why is attaining maximal peak bone mass important? Well, that's because obviously once peak bone mass is attained, you can't increase bone mass later in life. So you really want to build the strongest, healthiest bones you can before you reach that peak bone mass, because from there on, you really just are taking from your bones instead of adding to them. Peak bone mass is predicative of fractures later in life. And just a 5 to 10% difference in peak bone mass has been shown to result in a 25 to 50% reduction in hip fractures later in life. And 5% during peak bone mass is not that big of a change. So little changes in lifestyle really can make a direct impact. But bone matters also during adolescence and childhood. 30 to 50% of children experience a fracture by the end of their teenage years. And you can see for females that between 5 to like 14 age group, and in males, really that 10 to 14 age group, there's a large increase in risk of fractures. And that's because bones are elongating. And so they haven't become as dense as they are as an adult or by the time they reach peak bone mass. There's an 89% increase in childhood fracture risk per 1 standard deviation below the age and sex-specific median bone mineral density. So genetics of peak bone mass, we learned a lot about peak bone mass from twin studies. And we know that heritability of bone is up to 80%. And I'll talk about how, you know, especially if you're a female and your mother or grandmother has osteoporosis, it's very likely that you'll also be predisposed to having osteoporosis as well. But 20% is influenced by lifestyle factors and sex hormones during puberty. So if you think that 5 to 10% change in peak bone mass resulting in that 25 to 50% decrease in fractures, Up to 20% or more could be influenced by nutrition and lifestyle factors. Areal bone mineral density is lower among daughters of women who have osteoporosis, and familial resistance is expressed prior to puberty. We also know from genome-wide association studies that there are over 70 loci associated with adult bone density and/or fractures. And this chart just gives you a little example of how genetics of peak bone mass, kind of work. There are obviously differences in males and females. Males tend to have a higher bone mineral content compared to females, but you also see that African American have higher bone mineral content compared to non-African American individuals. And so again, you see some major genetic differences among race. So the timing of peak bone mass, also very genetically related. It's when timing of the plateau and bone accretion differs by sex and skeletal site. For instance, the lumbar spine plateaus in one's by about 30 years old, but bone loss in the hip begins occurring in a teen's early 20s. So if you think about all these nutritional factors, I talk a lot about teenage girls in the latter part of this lecture. It really, really matters. And I think we're really setting up teenage girls for osteoporosis later in life in this country. So girls who enter puberty earlier have greater bone mass. And so a lot of people talk about maybe food additives and girls going through puberty earlier, but fat cells actually secrete estrogen. So as the childhood obesity epidemic increases, girls go through puberty earlier, and then they end up having higher bone mass. And we'll talk a little bit about how weight also influences bone mass across the lifespan as well in just a few moments. So this is one of my favorite charts. We published this back in 2016 when we wrote the National Osteoporosis Foundation's position statement on peak bone mass. This shows you the dotted line are males and the solid line is females. And you see the little red dotted line below, that is a female with suboptimal lifestyle factors. So you can see how much earlier in life that you can push your skeleton into the osteoporotic state just by suboptimal lifestyle factors. And 60 years old is not that old. So with this whole position statement from the National Osteoporosis Foundation, we did a systematic review on all the lifestyle factors that influence peak bone mass. And what we really found is that calcium strongly has an influence. Physical activity has a strong influence. Funny enough, when you combine calcium, protein, and physical activity, you get a synergy there. So, obviously it's not just one component of nutrition that's important. Dairy, obviously the most important food group. We'll talk about it having the most bone building nutrients versus any other food group in just a few moments. Vitamin D, a very big component of fortified dairy products and a nutrient that not a lot of Americans get enough of. But just because there was a limited or inadequate grading doesn't mean that these nutrients don't have an effect. This is just when you look at all the randomized control trials, all the epidemiology, and a lot of times, for instance, in the case of fruits and vegetables, we know from a biochemical standpoint that fruits and vegetables are very good for bones, but there's not a lot of randomized control trials in the area, so the research is really limited. So these recommendations depict how strong the research is right now and not necessarily reflect what a public health opinion should look like. So let's move over from peak bone mass to young to middle adulthood. And this is when bones just basically stay at their stable state if you're doing everything correctly from a lifestyle standpoint. Like I said, bones are continuously remodeled throughout life to regulate mineral homeostasis. and repair micro-damaged bones from everyday stress. And actually, micro repair mechanisms are something that really make our bones strong. So you'll see in a few moments when we talk about physical activity, it's those impact exercises that cause micro abrasions that really help strengthen bone. It's kind of like working out. You lift those heavy weights and you build stronger muscles. Bone is the exact same way. So modeling and remodeling occur so that about 10% of the skeleton turns over every year. Breakdown or resorption and formation, like I said, are at a stable state. They're in balance during the young and middle adulthood. And there's also a calcium balance if you are consuming 3 servings of dairy a day and eating according to the dietary guidelines, which I'll talk about in just a few moments. Wolff's Law, very important. Lots of people are on diets, right? Wolff's Law says a healthy person will adapt to the load under which the body is placed. So basically, if you gain a lot of weight, your bones become larger to support your structure. The opposite is also true. If you do a fad diet and you lose 70 pounds in 6 months, you're going to get a lot of loss of bone in there, and that predisposes you to osteoporosis. So the little tip that nutrition scientists always say, 1 pound a week, lose weight gradually, that really goes double for your bones, because you really can weaken your bones by losing weight rapidly. In older adults, as people age, the rate of bone resorption or breakdown far exceeds the rate of bone formation. And this really starts in women when they reach menopause. The strongest driver of bone is estrogen. And so when a woman goes through menopause, that protective hormone, is now gone. And unless they're on hormone replacement, they tend to lose bone at a faster rate. And this is why developing osteoporosis increases as a woman reaches menopause. Some of our new research, really fascinating, shows that there might be a critical time point at which nutrition really matters. We've looked at the women right before they enter the menopause transition, and we looked at their calcium intake. And what we found is that if you had high calcium intake at least 6 months prior to the menopause transition, you lose less bone throughout menopause. So a lot of times in nutrition, we look at that postmenopausal state, that snapshot in life, but nutrition really is all about the lifespan. And we think this might be a critical time point that nutrition could be really important for women. Osteoporosis is a systemic skeletal disease characterized by low mineral bone mass and microarchitectural deterioration of bone, more specifically, a decrease in the number of trabecula, coupled to trabecular thinning and loss of connectivity, as well as a decrease in cortical thickness and an increase in porosity of bone. And you can see the difference in an osteoporotic bone and a normal bone to the right of your screen. You might have also heard of low bone mass, which has formerly been called osteopenia. Osteopenia or low bone mass is probably the strongest predictor for osteoporosis in middle adult to late adulthood. So clinical diagnosis of osteoporosis. Osteoporosis has traditionally been diagnosed of having a T-score of -2.5 or lower at the spine or hip by bone mineral density testing using dual X-ray absorptiometry, or what we know commonly in the research field as DEXA. This is just commonly known as a bone test among consumers. Postmenopausal women and men age 50 or above should be diagnosed with osteoporosis if they have a demonstrable elevated risk of future fractures, which includes the traditional diagnosis of a T-score of less than -2.5 at the spine or hip, a low trauma hip fracture, a low bone mass, which is defined as a T-score of less than -1.0 by bone mineral density testing, who sustain a low trauma vertebral, proximal humerus, pelvis, or in some cases, a distal forearm fracture. Elevated fracture risk based on the World Health Organization's fracture risk algorithm, or what we know as FRAX. This is a new marker. And this criteria was published by the National Bone Health Alliance and complies with current ICD-10 codes. So why is osteoporosis relevant? It's actually one of the top 10 costs to our healthcare system in the US. 16% of men and 29.9% of women above the age of 50 have osteoporosis. 46.3 and 77.1% of men and women above 80 have osteoporosis. Estimated costs are $19 billion a year to the US healthcare system, and that's a 2007 number. So you can imagine if we redid the data today. 1 in 2 women and 1 in 5 men experience an osteoporotic related fracture in their lifetime. And I should note that particularly if you have a hip fracture, there is about a 25% chance you won't live 1 year. So very, lots of cost, both indirect and direct costs related to osteoporosis. There are about 2 million fractures that happen every year here in the US. And if you compare that to heart attacks, 1.2, strokes, 795,000, and new cases of breast cancer, 295,000, you'll see that bone health is a real issue in this country. And it sucks because, you go to your doctor, you get your blood tested and you have high cholesterol, you get your blood pressure checked. It's pretty indicative of, development of heart disease. But with bones, we don't really know how our bone health is until we fracture and it's too late. So that's why it's really smart, if you have a family history, to talk to your doctor, to take those positive lifestyle changes that we're going to talk about in a few minutes. So these are just some risk factors for osteoporosis: genetics, excessive thinness, inadequate calcium intakes, vitamin D deficiency or insufficiency, smoking, excessive alcohol intake, lack of physical activity, immobility, high salt intake, comorbid conditions we'll talk about at the end of the presentation, type 2 diabetes and chronic kidney disease, and then medication use, steroids, proton pump inhibitors, birth control, particularly during those teenage years, can all affect bone density in the near future and later in life. Okay, so let's jump right into the bone building nutrients. First up on the list, obviously it's calcium. Calcium is the principal mineral that makes your bones strong. 99% of calcium is stored in the body and teeth. The rest circulates in the blood and is used for processes like muscle contractions, nerve transmissions, and blood clotting. And for these biological purposes, if you don't have enough, your body controls the calcium in your blood. So when you don't get enough from food, your body begins to pull it from the bone so that it can maintain its physiological functions like blood clotting, nerve transmissions, and muscle contraction. It also pulls minerals like calcium from the bone to buffer pH changes. So if you have a really acidic Western diet, like most people, your body starts pulling minerals out of the bone to buffer that pH to keep your body stable. So everybody always says, okay, but I can get enough calcium from vegetables. Not really. This is a big common misconception, and this is a publication by my dear friend and mentor, Dr. Connie Weaver, where she basically calculated the amount of servings of other typical foods that you would need to get the amount of calcium from 1 cup of milk. Now remember, dairy calcium is more bioavailable than most other calcium from maybe different types of vegetables or even fortified foods. So, and usually those vegetables and fortified foods have a lower amount of calcium to begin with. So you really have to work hard or take a supplement to get enough calcium if you're particularly vegetarian or vegan. You got to have those 3 servings of dairy. And you can see just 15.25 servings of spinach to get 1 cup of milk. Almonds, 4.75. White beans, 5.5. Vegetables in particular contain phytates and oxalates, which bind calcium and holds them tight, and it prevents your body from absorbing them. So don't just think that you can get away with not drinking your low or non-fat dairy products, because that's not the way it works. All right, let's jump back into this acid-base balance. So your body pH is about 7.35 to 7.45, and much of the diet is acidic in the Western hemisphere. And so it kind of pushes your body down to that 7.35, pH range. But your body's going to resist that really hard, because when you have changes in pH, you start denaturing proteins and a lot of things in your body start going crazy. So your body tightly regulates its own pH. How does it do that? Again, it pulls those minerals from bone to overcome changes in pH. And this is really striking. And again, I'm going to go back to the 14 to 18-year-old girls with this and vitamin D. Look at the ones who are most insufficient when you look at food only. A very large portion of girls that are 14 to 18, right before that point of peak bone mass in teenage girls occurs. They don't get enough calcium. They're not building the strongest, most dense bones possible, and we're predisposing them to osteoporosis. And this is one area where public health really, really, really needs to focus, and it offers some really long-term healthcare cost savings to focus in on children and adolescents when it comes to bone health. So how calcium supplements affect intake, right? So teenage girls grow up, they get to be my age in their mid to late 30s, and they think, oh my gosh, my mom just had an osteoporotic fracture, I better start taking a calcium supplement. So you see calcium intakes in the dotted lines really drive, supplemental calcium really drives total calcium intake in females. And you can see as you age from food, calcium intake goes down, right? As we age, we consume less food. Sometimes it's a little harder to swallow. So our energy requirements, kind of go down a little bit. Really, really important that you focus the diets of your patients, to be calcium rich, especially as we age. Vitamin D. Adequate vitamin D status is needed for calcium absorption in the intestine. So vitamin D tells your body to absorb calcium. The two nutrients don't need to be ingested simultaneously. Your body also regulates blood levels of vitamin D. As you probably know, vitamin D is also the sunshine vitamin. And I got back from Florida recently. I had this wonderful tan, got a lot of great vitamin D, but I still supplement because I'm inside most of the week. I try to get those dairy products and fortified foods and take a supplement when I need it. Vitamin D also puts calcium in your bones. It tells your body to put the calcium that you absorb into the bones. Deficiency is very common in the US, especially in the winter in the higher degree latitudes. Breastfed infants, that is a group that is at risk for deficiency of vitamin D, since breast milk only provides small amounts. Usually infant formula is fortified. Older adults lose the ability to synthesize vitamin D when the sun hits the skin. Older adults are also more predisposed to being inside. Think about nursing homes or assisted living facilities. So that is another group at high risk of vitamin D deficiency or insufficiency. Although vitamin D can be synthesized by the skin when exposed to the sunshine, the sun's not a reliable source of vitamin D for most adults. And there was a study out of Boston a few years back that showed you would need full arm and full leg exposure to the sun for 30 minutes, 3 times a week to get your vitamin D requirements. Now in the summer, I'm a beach bum, I can do that. In the winter, when it's freezing cold outside, I'm wearing long sleeves, I'm not really outside. So it can be hard for most individuals to get enough vitamin D from the diet. The National Academy of Medicine recommends between 600 and 800 IU, or 15 to 20 micrograms of vitamin D per day from food or supplements. However, societies like the Endocrine Society, the National Osteoporosis Foundation, and American Bone Health recommend more. They recommend 800 to 1,000 IU per day for healthy individuals. There are few food sources of vitamin D, so most people need to take a supplement. The Endocrine Society additionally recommends if you have osteoporosis, you should take 50 micrograms or 2,000 IU per day. And I do this all the time as a good practice in the winter months. The tolerable upper intake level for vitamin D is 4,000 IU per day. There's a safety factor involved with that. Adverse events really aren't seen at levels below 10,000 IU per day in the general healthy population. So I think 2,000 IU per day is perfectly appropriate for a healthy individual. Vitamin D, obviously from food, you see 90% of Americans don't get enough, including those 14 to 18-year-old girls. And, not many kids supplement. So really have to push, things like low and non-fat dairy for young children and teenagers to help them meet their requirement. Okay, so this is how calcium and vitamin D interact. When you have low calcium intake and low vitamin D status, insufficient calcium is absorbed, right? So you see a fall in extracellular calcium. That's the calcium on the outside of the cell that's regulated in the blood. When you see that happen, you get an increase in parathyroid hormone. And what does an increase in parathyroid hormone do? It tells you to decrease urinary calcium so that you're conserving the most calcium in your body you possibly can. It also increases bone turnover, right? That's bad because you're starting to resorb calcium from the bone to compensate for that fall in extracellular calcium. What happens when you have increased PTH? Increase in serum 125 hydroxy vitamin D, or your blood vitamin D levels. And this triggers increased intestinal calcium absorption. So if you're consuming too much, we'll talk about this in a minute when I mention supplements, but if you're consuming too much calcium, your body will absorb less of it. When you don't have enough, your body will absorb more of it. So this is the cycle that calcium and vitamin D play together. So what about supplements? Calcium carbonate needs stomach acid to be absorbed, so it's best to take it with a meal. Calcium citrate isn't as dependent on stomach acid, so it can be taken at any time. And it's also best for people using proton pump inhibitors and H2 blockers. Now, here's the important thing. Your body only absorbs 500 to 600 milligrams of calcium at a given time. So if you see those 1,200 milligram supplements out there, half of that's going out the other end and your body's not using it. So if you're taking a supplement, it's important to spread your calcium out throughout the day. Same with different dairy foods. Have a glass of lower non-fat milk at breakfast, one at lunch, one at dinner. Spread it out so that you get the maximum absorption. Studies have consistently shown that people with high calcium intake and lots of dairy products are also less likely to have colon cancer. So another reason to spread those products throughout the day, make sure you get your recommended 3 servings, which is the recommendation for most adults. Do not exceed the UL for calcium. More is not better. The RDA for the highest RDA is 1,300 milligrams per day. And above that, you're really not going to do your bones any better. So it's not good to take more or to get more. So always look at your supplement labels, look at your patient's supplement labels, and really pair that to with what they're eating. Talk to your patients. So it's better to take calcium supplements with a meal because particularly vegetables have oxalates and phytates. Oxalates bind calcium, or calcium binds oxalates, and oxalates are often absorbed and contribute to kidney stone formation. Now, you've probably heard the tale that calcium supplements cause kidney stones. This isn't necessarily true. The study, the Women's Health Initiative, which is one of the largest randomized controlled trials we have in nutrition, showed that 1 in 273 women taking calcium supplements versus a placebo developed a urinary stone. However, these women were allowed to take personal supplements. So in a clinical trial, I ethically can't tell you to stop taking your calcium supplements. So you might be on the treatment or placebo and taking a personal calcium supplement. So you would imagine if you were taking a personal calcium supplement and the treatment calcium supplement that you would see an increased risk in kidney stones. Well, they didn't. So double the dose wasn't the same as one dose. And this suggests that there's no likely increased risk in the healthy population. Also in the study, you see that people that were adherent to the treatment. So if you look at people who were 80% adherent over the few years lifespan of this trial, 80% adherent to the calcium supplement, no increased risk in kidney stones. And there's really no biological mechanism as to why calcium supplements would increase kidney stones. And about 90% of kidney stones are oxalate derived, not actually calcium derived. But if you are worried about kidney stones, calcium citrate is the more soluble form and should be recommended for those with concerns over kidney stones. Or you could just go the right route and preach good nutrition and lifestyle. Magnesium, one of my favorite nutrients. We have 3 clinical trials going right now on magnesium. It's involved in over 600 enzymatic reactions in the body. About 60% is stored in the bone. It also contributes very much to bone density. A third of the skeletal magnesium resides on cortical bone, either on the surface as the hydroxyapatite crystal or in the hydration shell around the crystal. And as with magnesium, or as with calcium, the skeleton serves as a reservoir for exchangeable magnesium. So guess what? If you don't get it from the diet, your body starts taking it from bones. Where do you get magnesium? Dark green leafy vegetables, anything with chlorophyll. Remember, magnesium's the center of the chlorophyll molecule. Magnesium insufficiency promotes oxidative stress, partially due to reduced antioxidant defenses that occur when an individual has low magnesium status. And the increased amounts of free radicals potentiate activity of osteoclasts. Remember, those are those bone resorbing cells, and it depresses that of the osteoblasts, which are your bone formation cells. Phosphorus. Phosphorus, along with calcium, is the major component of the hydroxyapatite crystal. It is an important nutrient for bone health, but intakes in the US well exceed the human requirement. And this is because phosphate additives are very widely used in foods. Lots of foods have natural phosphorus in there, but we use phosphates for anything like emulsifiers and different types different types of purposes in the food to keep it stable and fresh. Phosphate additives may have negative effects on bone metabolism when consumed in high quantities. Phosphate additives are 100% absorbed, whereas the phosphorus in the diet, like in dairy products, are more gradually absorbed like calcium. You'll see that bioavailability is very similar in food products. Potassium. Potassium, like magnesium, contributes to the acid-base balance. So remember, we talked about, the acidic Western diet. Potassium is one of the main minerals in food that can really buffer that naturally. When you don't have enough potassium, your pH begins to drop. Where do you get potassium? Fruits and vegetables. What don't we get enough of here in the US? Fruits and vegetables. Higher intakes of fruits and vegetables have been associated to benefit bone health, and it's probably due to the potassium, maybe also a little bit of the dietary fiber in there. But potassium is definitely the leading candidate for this benefit, because we know in supplement trials, potassium bicarbonate and citrate, but not sodium bicarbonate and citrate, reduce urinary calcium excretion. So again, it's showing it's not the bicarbonate or the citrate, it's really the potassium that's buffering that pH and preventing calcium from being excreted in the urine or being taken out of the bones. Vitamin A plays an essential role in the development of osteoblasts. Too much vitamin A is linked to bone loss. Adverse effects may occur at a level of retinol intake that is only about twice the recommendation. So from food, you're usually fine, but you really have to watch your patient's dietary supplement regimen. If you're taking a multivitamin, lots of multivitamin manufacturers will have half of their vitamin A as beta carotene or a vitamin A precursor. Those are not toxic. of the carotenoids, alpha carotene, beta carotene, and beta cryptoxanthin. They can be converted to vitamin A, but they aren't not toxic to your body, whereas pure retinol can give you a vitamin A toxicity. And so both really high vitamin A and really low vitamin A have been associated with detriment to bone. Protein provides the glue for bone mineral. I talked about that a little bit in the intro to this lecture. There's a beneficial relationship between high protein intake and bone density for nearly all sites. We did a systematic review 3 years ago and showed this. Especially as you get older, you gotta have enough protein. What don't older adults get enough of more and more? Protein. They have a hard time swallowing. They don't eat as many calories. So protein is really, really, really important for bone health. A recent review by the International Osteoporosis Foundation finds no detriment to increased protein intakes. So it's safe to recommend, protein to your patient. Calcium and protein have synergistic effects on bone density, especially when combined with physical activity. And older adults, adolescents, active individuals, it's likely they need more protein. The protein recommendations are very outdated. And there's new tracer studies that show older adults in particular could benefit from 1.2 to 1.4 grams per kilogram of body weight of protein. Now, the current recommendation is 0.8 grams per kilogram of body weight. Active individuals also up there, the different athletic societies recommend between 1.2 and 1.7 grams of protein per kilogram of body weight, depending on the type of exercise and the intensity of the exercise. So again, adolescence, very important. A lot that is coming around in the protein field recently. All right, let's talk about some nutrients that don't have as strong of a scientific relationship to bone, but may have a potential relationship. First, zinc. Alkaline phosphatase, which is a bone marker, uses zinc as a cofactor during bone mineralization. About 29% of zinc preferentially localizes in bone, like calcium, like magnesium. When you don't get enough zinc from the diet, your body pulls it from your bones. So again, it's contributing to that bone mineralization. Zinc has also been suggested to promote osteoblast proliferation. Those again are your bone building cells. Iron. Iron overload and deficiency is associated with weakened bones, suggesting that balanced bone homeostasis requires optimal iron levels. There is emerging evidence that suggests both high and low iron influence differentiation and activity of both osteoclasts and osteoblasts. Remember, your bone resorbing and your bone building cells. And this does in a way that promotes bone loss. So remember, especially as we age, the regulation of those osteoclasts and osteoblasts is really important, because as we get older, those osteoclasts turn up and the osteoblasts, turn down. So we want to maintain those in regulation as long as we can, so we don't eat away from our bones too early in life. Okay, vitamin B12, another one of my favorite vitamins that I can geek out with. It has been suggested to influence the quality or microarchitecture of bone. And while these mechanisms aren't well understood at this time, it seems to be due to effects on formation of collagen or the ability to alter metabolism of the osteoblast. However, the study findings are mixed in this area. It's important to note vitamin B12 is unique, and older individuals often lose the ability to absorb vitamin B12. In young, healthy adults, you produce what's called intrinsic factor, and you lose the ability to produce this intrinsic factor as you age. Intrinsic factor is what helps you absorb vitamin B12. So a lot of older adults need to take a supplement or to really focus down in vitamin B12 rich foods. Vitamin C, humans are the only primate that does not produce vitamin C in their body, and actually other primates produce vitamin C in their body at 10 times the level of our recommendations. And so a lot of people think, did we get it right? So it's essential for collagen formation, and it increases absorption of plant-based iron. So vitamin C, super important if you're vegetarian or vegan, or, hey, if you're worried about, if you're worried about, just your general iron levels, a lot of people have low iron these days. It's good to co-consume different animal-derived foods with vitamin C, like, a lime or something like that, because vitamin C follows iron throughout the body. Um, Vitamin C is an important antioxidant and cofactor, which is involved in the regulation, development, and maintenance of several cell types in the body. It influences the expression of bone matrix genes and osteoblasts. And remember, 94% of bone is collagen. Vitamin C, also great for your skin, lots of collagen in your skin. Vitamin K, this is one that has really hit the supplement market lately, and I get a lot of questions on vitamin K. Yes, vitamin K is essential for carboxylation of many bone-related proteins, regulating transcription of osteoblastic markers and regulating bone resorption. So we know from a biochemical standpoint that vitamin K does have an effect on bone. A low dietary intake of vitamin K1 and K2 has been associated with decreased bone density. Particularly, menaquinone 4 is a form of phylloquinone that is used at doses of 45 milligrams per day for the treatment of osteoporosis in Japan. However, while there's good evidence that menaquinone 4 promotes bone turnover, recent randomized controlled trials have failed to show consistent protective effects on bone density of the hip. And what I'll say is there's two main clinical trials in this area from the same lab groups, same exact study, same exact design. One finds a benefit to bone density and one finds no benefit. So this is an area that really needs further research, but we know from a biochemical standpoint that there is a plausible biological mechanism to back why it would influence bone. The worry is that you really have to caution patients because vitamin K will counter blood thinners. So people who use warfarin, for instance, should be aware of supplements containing vitamin K. Trace minerals. You may hear of trace minerals like boron, copper, silicon, and strontium being used to promote bone health. Now, there isn't a lot of biology behind this, and there is not a lot of human research behind this. We also know that deficiency in these nutrients are very rare unless you have intestinal absorption problems. So for most part, these nutrients aren't of concern for most Americans and healthy adults. Dietary bioactive compounds. You've all heard of antioxidants, but this is what geeky people like me call antioxidants these days. The National Institutes of Health has defined dietary bioactive as compounds that are constituents of foods and dietary supplements other than those needed to meet basic human nutritional needs that are responsible for a change in health status. You can think about this as the wonderful anthocyanins or polyphenols in strawberries. Flavonoids are one of the most studied groups of dietary bioactives. They're found in a variety of plant foods and have the most potential of the bioactives to promote bone health. They're anti-inflammatory in nature, and remember, bone is a living tissue, so like all other tissues, there's an antioxidant pro-oxidant balance. There's a redox balance in there, and so flavonoids have shown to enhance bone formation and inhibit bone resorption through the action of cell signaling pathways. And you'll see this for lots of different chronic diseases. Remember, our bodies are super interconnected. So, unique to the dietary bioactives, soluble corn fiber has recently been shown to exhibit dose-response relationships with calcium retention. So, soluble corn fiber, it really led the way for us to start researching how adequate consumption of dietary fiber increases calcium absorption. So another reason that those fruits and vegetables are good for you from a bone health perspective, just aside from the magnesium and potassium. And so these might be due to significant increases in bone-specific alkaline phosphatase, which is a bone formation marker. So some really neat science coming around dietary fiber, which is considered a bioactive. Lactoferrin, this is a compound I've really recently got super interested in. It's an iron-binding protein that belongs to the transferrin family, and it's recently been shown to promote bone growth by stimulating proliferation and differentiation of osteoblasts, as bone building cells. It's also suggested to have a physiological role in bone growth and healing, and as a potential therapeutic role as an anabolic factor in osteoporosis. So that ability to halt the body from breaking down bone. A small clinical trial showed that supplementation with milk ribonuclease enriched lactoferrin resulted in a significant reduction in bone resorption and an increase in osteoblastic bone formation in postmenopausal women. So lots of new research coming from this area as well. Okay, alcohol. Moderate alcohol consumption defined as 1 drink for women, 2 drinks for men. That doesn't per day. That doesn't mean you get your big wine glass. I have that big wine glass that can probably hold a bottle of wine. That doesn't count. A drink is defined as 14 grams of alcohol in the US. That's the equivalent to a 5-ounce glass of 12% alcohol by volume red wine, or maybe like a 12-ounce 5% alcohol by volume can of beer. So you can't just go overboard with your big wine glass. I know we all like to do that. But heavy alcohol use, particularly during adolescence and young adulthood, can really disturb peak bone mass development and dramatically compromise bone quality, which increases your risk for osteoporosis later in life. Now, it's also important as you age, right, that you don't binge drink or, because alcohol can take that calcium out of the bone. Moderate consumption of beer containing high amounts of silicon in the soluble form of orthosilic acid has been suggested to promote bone density and type 1 collagen synthesis. Now, that doesn't mean you drink 20 beers, and also the silicon in different beer varieties and brands differs, and you can get the same silicon in grains like granola or oat bran. But if you're gonna have an alcoholic beverage, maybe 1 beer a day, maybe you'll help you in the long run. Who knows? It's definitely a fun area of research. Red wine got the heart disease. I guess beer is starting to get the bone health side of things. So caffeine. If you have good calcium and vitamin D intake and partake in regular exercise, there's little concern about moderate caffeine intake. The Academy of Nutrition and Dietetics define moderate caffeine intake as less than 300 milligrams per day, less than 200 milligrams per day if you're a pregnant woman, erring on the cautious side. Caffeine modestly reduces calcium absorption by about 4 milligrams per cup of coffee, but this can be offset by adding 1 to 2 tablespoons of low or non-fat milk to your coffee. Excessive caffeine intake causes increased calcium in the urine, and some studies indicate that coffee consumption may actually have protective effects because they have these wonderful dietary bioactive compounds that we talked about present in coffee. Salt. High salt intake is a well-recognized risk factor for osteoporosis because salt increases urinary calcium. A recent stable isotope study of high salt intake showed increased urinary calcium excretion and that high salt intake affected bone calcium balance even with a high calcium diet. So salt contributes to the acid load in the body, and it results again in the body pulling minerals from the bone, even if you are sufficient in calcium. Okay, let's go into dietary patterns. As nutrition, we like to talk very reductionist, but it's really about being a global approach, right? People don't consume nutrients, they consume foods. So let's talk about dietary patterns. Our dietary guidelines for Americans, which most of you all have probably heard about recently, they just published at the end of 2020. They're published every 5 years. They reflect the current science on what to eat and drink to build a healthy diet that can promote healthy growth and development, help prevent diet-related chronic disease, and meet nutrient requirements. It's developed and written for you all, a professional audience, including policymakers, healthcare providers, nutrition educators, and federal nutrition program operators. It is not written for consumers, although the mainstream media like to pick it up a lot. It is made for health professionals to help counsel their patients. You might have seen My Plate, which I'll talk about in a few minutes. That is the consumer-facing piece that reflects the dietary guidelines. The dietary guidelines are the cornerstone of U.S. nutrition policy, used to form the basis of all policy and programs of the U.S., support nutrition education efforts, guide local, state, and national health promotion and disease prevention initiatives, and inform various organizations and industries. Lots of products the industry put out are because of changes in the dietary guidelines to try to create healthier consumers. If you look at SNAP, WIC, the National Food Lunch and Breakfast Programs, all of these federal nutrition assistance and education programs have to reflect by law what is in the dietary guidelines. More recent iterations of the dietary guidelines focus on a more global approach. How awesome. Since it's acknowledged that people don't consume nutrients in isolation, but various combinations. It also reflects growing evidence that dietary patterns have interactive, synergistic, and potentially cumulative relationships. Remember, I talked about calcium, vitamin D, protein, and exercise. So recent iterations of the dietary guidelines reflect that. Okay, My Plate, the consumer-facing graphic that's based on the dietary guidelines. It's divided into 5 basic food groups: fruits, vegetables, grains, protein foods, and dairy. You can check it out at choosemyplate.gov. They have lots of recipes and tools to help you and your patients make healthier choices. The information on the website is based on life stage, so your age, physical activity levels, gender, and other important attributes. Dietary patterns in bone health. Lots went on during the 2020 dietary guidelines development in regard to bone health. There was moderate evidence that indicated a dietary pattern high in fruits, vegetables, legumes, nuts, low fat, dairy, whole grains, and fish, and lower in particularly processed meats, because remember, lean meat is a great protein source that impacts bone in a beneficial way. Lower in sugar sweetened beverages, so that would be like a soda, and sweets are associated with favorable bone outcomes in adults. And this is primarily a decreased risk of hip fracture, right? The most deadly and costly fracture that can occur. Moderate evidence also suggests that a beneficial effect of dairy intake on bone health in middle age to older adults. And this is a large systematic review that my group did just last year. There literally were hundreds of studies included in this. And if you go to my website, you'll be able to download a copy of this very extensive document. Okay, so let's move into the food groups. Dairy. The dietary guidelines suggest that we move to low fat and fat-free milk or yogurt. 90% of Americans don't get enough dairy. The amount each person needs varies between 1.5 to 3 cups. Most adults need 3 cups. Younger children need 1.5. Remember, it's a gender and life stage recommendations. And just FYI, 1.5 ounces of cheese can be considered a cup equivalent of dairy. The dairy group provides more bone building nutrients than any other food group. So that's why dairy is so stressed, for bone health, particularly in children. It really does make your bones strong. And so, there are calcium, phosphorus, vitamin A, vitamin D, riboflavin, B12, protein, potassium, zinc, choline, magnesium, and selenium, all in the dairy group. Consuming dairy products provides additional health benefits. We talked about colon cancer, but the dietary guidelines really emphasize maintaining and building strong bones at all life stages. And for those of you who just like to geek out that want a copy of the slides, this is how, this is how all the dairy nutrients influence bone strength. This is in the publication we published last year that's free online. My colleague, Reagan Bailey, a phenomenal scientist, made this slide for health professionals and researchers to be able to better visualize how dairy nutrients influence bone strength in a beneficial manner. Dairy intake, as you can see, decreases with age, right? And if you look at that, like 2 to 5, 6 to 11, even 12 to 19, my thoughts are the National School Lunch Program does a pretty good job at getting milk to kids, but when they get to those teenage years, they stop drinking their milk and they go for the sugar sweetened beverage, or they go for, some other type of product because they get a mind of their own. And that's when those teenage girls don't get enough calcium. It's directly correlated with calcium decreases at that age. So really important, especially for young girls to get that calcium from dairy. Lactose intolerance. Many people develop lactose intolerance with age. These individuals often avoid dairy products and they don't get enough calcium because of that from the diet. To reduce the symptoms of lactose intolerance, you can try lactose-free milk. There's plenty of milks that are lactose-free out there on the market. It's real milk. It contains the same nutrient package, just without the lactose. Think hard cheese. Most of the lactose is removed during the cheese making process in hard cheeses, and you'll see during fermentation that those little microbes like eat up all the lactose, which is milk sugar. So they feed on them, and so it's gone by the time it gets fermented. Same with yogurts, live and active cultures. They eat up that lactose, that milk sugar, and that's what they use to ferment. And so with fermented products, you have a much better chance of not reacting. Plant-based milks, fortified foods, and supplements. Remember, with plant-based milks, I am not a fan whatsoever. It's always important to read the label. They might or might not be fortified with the same amount as what you would find in milk. And then also dairy has all those other nutrients that we just highlighted. And so most of those plant-based alternatives are just water, titanium oxide for the white color, and maybe a little bit of calcium and vitamin D fortified in them. So you really, really, really have to read the food label for the plant-based milks. There are also other fortified food options. Orange juice sometimes is fortified with calcium and vitamin D. Many cereals are fortified with various nutrients. And so again, advise your patients to read the food label. And that's actually what the food label is created for, so that consumers can side by side compare, what's in a serving of food. Lactose intolerance is not a food allergy. There are individuals who are allergic to dairy that have a histamine response, and those individuals should completely avoid dairy. Okay, fruits. Focus on whole fruits. The amount each person needs varies from 1 to 2 cups per day, depending on your gender and life stage. Fruits are sources of many essential nutrients that are underconsumed, including potassium, dietary fiber, vitamin C, and folate. And they're also, like I said, important for maintaining that acid-base balance and keeping those minerals like calcium in your bones. Very interesting. It looks like dried plums, or what we used to know as prunes, because prunes are a little like not so where they're associated with older people and bowel movements, but the dietary bioactives and the dietary fiber in prunes have actually been shown in several randomized controlled trials to promote bone density, even above other dried fruits like dried apples. So, if you're really interested in getting fruit in your diet, good for your GI health and also good for your bones. Vegetables, vary your vegetables. The amount each person needs, depending on the gender and life stage, is 1 to 3 cups per day. This is based on their nutrient content. Vegetables are organized into 5 groups, so it's a good idea to mix those so that you get a variety of nutrients. They're important sources of potassium, dietary fiber, folate, vitamin A, and vitamin C, and they also help you maintain that acid-base balance. Grains. Make half your grains as whole grains. I disagree. It's the only thing in the dietary guidelines I disagree with. I think it should be 100% of your grains as whole grains, just because we know fiber is so important for you. The amount each person needs of grains varies between 3 and 8 ounces per day. Grains are divided into whole grains and refined grains. Refined grains are like white rice, white bread, white pasta. Your body breaks it right down into sugar and absorbs it, right? So you want that whole grain where that you've got all the nutrients, you've got the fiber, and it's a gradual release and breakdown of those carbohydrates. Doesn't spike your blood sugar as much. So grains are important sources of complex carbs, dietary fiber, B vitamins, and many minerals like iron, magnesium, and selenium. Grains provide the most dietary fiber. A lot of people think we get our dietary fiber from fruits and vegetables, but the majority of our fiber in the American diet actually comes from whole grains. Protein. Vary your protein routine, at least 8 ounces of cooked seafood per week. The amount varies between 2 and 6.5 ounce equivalents per day, depending on your age and gender. So 1/4 cup of beans, 1 egg, a tablespoon of peanut butter, or a 1/2 ounce of nuts and seeds can be considered a 1 ounce equivalent. However, again, if you're vegetarian or you're vegan, it's important that you learn about complementary proteins. I teach this in my Intro to Nutrition course all the time. So peanut butter, whole wheat bread, they have, that's balanced in amino acids. If you consume just whole wheat bread or just peanut butter, you don't get all your amino acids. That's why animal derived proteins are really important, because they're all balanced in the essential amino acids. And we know if you're limited in just one amino acid, a lot of your body, can't work. You can't build those strong bones if you're limited in that one amino acid it needs. So older adults and vegetarians sometimes don't get enough protein. And as you can see, very rich in many nutrients in the diet. Because of cross-linking, collagen molecules in bone often involve modification of amino acids. So when collagen fragments are released during bone resorption, they can't be reutilized to build new bone. So you can't reuse those amino acids. So you need a constant supply of amino acids in your body. And so that's why protein intake is constantly a good thing. There is a trend towards decreased protein intake with age. And like I said, protein needs may depend on age, body weight, and physical activity level. I talked a little bit about that. Substitution of animal protein with that from plants may be detrimental to bone due to lower intakes of nutrients such as calcium, phosphorus, and vitamin D. And there was actually a new study that just published in the American Journal of Clinical Nutrition that really showed, you pretty much have to get your protein from animal-derived foods like dairy, or else like you're really setting yourself up, particularly women, for osteoporosis and low bone mass later in life. Okay, a systematic review of over 37,000 subjects recently found that compared to omnivores, vegetarians and vegans had lower bone density at both the femoral neck and the lumbar spine, our two most critical bone density sites. Vegans also had much higher fracture rates. And this is actually kind of rare in nutrition if you look at systematic reviews, because not many clinical trials go long enough to really report a significant amount of fractures to where you can measure the difference in diets. So just the fact that vegans showed higher fracture rates shows you how strongly correlated a vegan diet is with osteoporosis and fracture risk. Individuals who are vegetarian and vegan need to work extra hard for enough protein, iron, zinc, calcium, vitamin D, riboflavin, vitamin B12, vitamin A, choline, omega-3 fats, and iodine. You better be taking your supplements, and you better be having a soy protein shake if you're vegan or vegetarian, because it's really, really, really hard to get enough of your nutrients from just a plant-based diet. Okay, dietary supplements are not intended to replace foods. Some people, we just talked about vegans and vegetarians, Those who suffer from malabsorption issues may need supplements. No healthy dietary pattern within the dietary guidelines supplies enough vitamin D. Those who don't get enough sun exposure need to supplement, which is most of us. It's best to look for national trusted brands. Don't just have your patients go on Amazon and buy, the mom and pop shop stuff that makes all these egregious claims. Go to your Caltrates, your Centrums, your Nature Made, your One-A-Days. Those are big companies that put a lot of investment in their brand, and you're not going to get something that's, that where what's in the box isn't what's on the label, or something adulterated that could hurt you. You can also look for independent testing laboratories like USP or NSF certification on the label. For each absent serving of dairy, you should supplement with 300 milligrams of calcium. Okay, we talked about dieting and rapid weight loss being associated with bone density. The low carb diets and other restrictive diets are really known for this. And so if you're going to be on a low carb diet, you really have to plan it correctly. Slower weight loss is much less apt to adversely affect bone, and recall that Wolff's Law in the prior section. Okay, so our final section on other lifestyle factors. Children and adolescents, this goes back to our position statement from the National Osteoporosis Foundation. Periods of growth are the best time to strengthen bone, and strong evidence supports physical activity and bone mass and density. But some people are like, well, what is that? 3.5 times body weight, 100 impacts, 3 days per week for 7 months has been shown to really produce results in children. So think about that as jump rope, jumping jacks, and such. In older or middle-aged and older adults, weight-bearing exercises and resistance exercises are best. Remember, that's when the musculoskeletal system is most important, because it's all interconnected. Weight-bearing exercises like jogging, climbing stairs, playing tennis, force you to work against gravity. It causes those little micro abrasions, which make your bones stronger. It's kind of like muscles. When you lift those heavy weights, you build stronger muscles. Resistance or muscle strengthening exercises also strengthen bones, but it also helps that whole musculoskeletal system. Other exercises like swimming are good for cardiovascular health, but not necessarily the best for bone health. And the Surgeon General recommends 30 minutes of physical activity on most days, preferably daily. Okay, medications that can harm bones, steroid-like medications, particularly prednisone, thyroid medications. Remember, parathyroid hormone strongly influences bone. Drugs that can reduce estrogen and androgen levels, like contraception. Certain diabetes medications, proton pumps inhibitors, and acids that contain antacids that contain aluminum. Selective serotonin inhibitors, loop diuretics, anticonvulsive medications, and blood thinners. Smoking. There's a direct relationship between smoking and pretty much every chronic disease, and it also increases bone density and increases your risk of fractures. So it's smart not to smoke cigarettes. I think that's been well established. Health conditions, chronic kidney disease. The kidneys really regulate mineral homeostasis in the body. Patients with CKD often have osteoporosis. Bisphosphonates can be problematic in patients with CKD. So it's important to really, assess your patient's kidney function and bone density at the same time. Serum calcium concentration should be more carefully monitored to prevent development of hypocalcemia, and vitamin D should be administered concomitantly. Minimal vitamin D3 supplementation can help prevent hypocalcemia. And of course, the best thing you can do for chronic kidney disease that also helps with osteoporosis, high fruit and vegetables with a focus on potassium. Diabetes. People with diabetes often have poor bone quality and an increased risk of fractures. Those with long-standing disease and poor blood sugar control and who take insulin have the highest fracture risk. Onset of type 1 obviously occurs at a very young age, and so this impairs peak bone mass development. Some complications of diabetes, such as nerve damage, muscle weakness, and episodes of blood sugar and vision problems, can increase the risk of fractures and falls, right? If you're weak, you're more likely to fall over, especially as you get older. Low fat and non-fat, or low fat and low sugar calcium foods like milk or skim milk, and low glycemic index fruits and vegetables are particularly important strategies for managing diabetes. Okay, so these are some resources. I took a lot of these resources from the American Bone Health website, the National Osteoporosis Foundation, the International Osteoporosis Foundation. You have some links to the systematic review we published. And then also you can get a full expanded view of this presentation if you want more at my website. And there's a nice little infographic that you can share with your patients and other health professional friends. And at this time, I think we're going to take any questions you all might have.
Great. Thank you so much, Dr. Wallace. You really provided an excellent overview of nutrition and bone health. And I'm going to give you just a few seconds to catch your breath before we jump into the Q&A. And while focusing on 3 servings of dairy a day can be easy as enjoying milk with meals, you can also visit usdairy.com for great tasting, plant-based, dairy-enhanced recipes to help people meet the recommendations for bone-building nutrients. While you're there, you'll also find all sorts of science summaries, specifically ones on bone health, inflammation, and chronic diseases, as well as some flashcards to help you compare and contrast the nutrient package of milk and dairy alternatives. The website also has great information and strategies to help people manage lactose intolerance. And then before we jump into the Q&A, I did want to share our next webinar that was created with feedback from our webinar participants. In previous webinars, we've addressed the dairy community's commitment to a sustainable future, but the participants keep telling us you wanted more, you wanted to know, you wanted to better understand how dairy is farming to the future. So I'm super excited to share that during our April 29th webinar, we'll learn firsthand from dairy farmers and other dairy innovators about technologies and on-farm practices to reduce food waste, greenhouse gas emissions, and improve water use and water quality. And you'll receive a link to the webinar registration is in the chat now, and it will also be in the follow-up survey. So with that, we'll dive into some questions. You all are very engaged. We've received a slew of questions, so we'll try to get through all of them, and we might bundle some together. So hold on one moment, please. We've gotten quite a few questions about calcium supplements and cardiovascular disease and risk for MI. In particular, some questions about calcium supplements and hardening of the arteries instead of going to the bones. Can you comment on this?
Yeah, absolutely. And I actually did a lot of this work while I was at the National Osteoporosis Foundation as their chief scientist. It was a huge issue, particularly among postmenopausal women. No, calcium supplements do not cause heart attacks or myocardial infarction. We have very robust clinical trial data behind that position. In fact, the National Osteoporosis Foundation, I believe back in 2016, we partnered with the American Society for Preventative Cardiology and put out a position statement in Annals of Internal Medicine that really showed the evidence and showed that there was no reason to be afraid of calcium supplements, so long as you stay under the UL. If you go over the UL, there is that small increased risk of kidney stones, but as long as you're staying under that 2,000 to 2,500 milligrams per day, calcium supplements are perfectly safe.
Great, thank you. Probably no surprise, we have a lot of questions about protein as well. The comment was made that increased protein intake has no negative effects. However, isn't increased protein intake correlated with increased urinary calcium and consequently calcium loss?
Yeah, so this is a really great example of how technology has really come about. You know, when we thought protein intakes increased urinary calcium, we were doing early metabolic studies in like the 1970s and 1980s. And that's where, you know, we gave you a known amount of calcium and a known amount of protein, and we scraped your armpits and we measured the amount that you sweated out, and we measured the amount in your urine. And we showed that the increased protein particularly increased urinary calcium. But what we didn't know, and what we now know from tracer technologies, is that protein actually increases calcium absorption to where it equals out what you use in the urine or what you lose in the urine. So again, no real detriment. And that's one of the things that position statement from the International Osteoporosis Foundation really covers. And we looked at that in our systematic reviews as well a few years ago.
Great, thank you. Another hot topic in general just is the keto diet. So can you speak to the impact of the keto diet on bone health?
Yeah, and this is an area that's really special to me. All conflicts of interest, being transparent. I was the spokesperson for the Atkins diet last year and the year before. I think that lower carbohydrate diets have their place. I have a fairly lower carbohydrate diet currently. And so I think with dieting, look, you can do a keto diet where you go to a fast food restaurant and get a triple cheeseburger without a bun, or you can do a keto diet where you have a salad with a lot of fruits and veggies on it that's grilled chicken. And so both are low carb diets. Obviously, the grilled chicken's going to have your protein, have that skim milk on the side. The fruits and vegetables provide that potassium, magnesium, things that we, promote for bone health. So in regard to different diets, yes, keto diets have been associated with decreased bone density because you lose weight rapidly. But if you do a moderate carbohydrate diet or, let's say like 40 to 60 grams of carbohydrates, per day, you lose weight gradually. You focus on healthier fruits, vegetables, whole grains, low and non-fat dairy, lean meats, and you can do this right to where it doesn't hurt your bones and you can actually lose weight in an effective manner. And also helps keep it off, right? When we lose weight like really quickly, we don't tend to stick to those kind of fad diets. So I always emphasize smaller changes instead of I'm not going to get rid of my Haagen-Dazs chocolate peanut butter ice cream. It's just not going to happen. I'm going to have it every now and then. But for the most part, I really believe in the lower carb diets. So it's just about doing them appropriately.
Gotcha. Thank you. Another kind of trendy thing, can you speak to collagen supplementation and bone health?
Collagen supplementation, it's a really interesting area. Before the last 5 years, I would have said no, same as just getting your protein from the diet. It's definitely, we don't have direct comparisons between animal proteins and collagen supplementation. It all depends on the amino acid. So all proteins are broken down into individual amino acids, which are absorbed by the body. So the important thing is you get that balance of amino acids, right? And so that's why we push animal-derived foods like dairy so hard, because a lot of plant-based foods don't have that balance in essential amino acids. When it comes to collagen supplements, it's kind of the same thing, but if you look at the smaller randomized control trials that are coming about, you really see that collagen supplements, they might have an effect. It's bone is hard to study, right? Because bone density, you have to have a 6-month or a year clinical trial. So that means you have to get the person to adhere for that long, which is incredibly difficult to do. And so I think that collagen supplements on the research side have the potential to help, especially if you're a vegetarian or vegan. But I think for now, from a public health perspective, it's just about getting enough protein from the diet, whether that's a supplement or whether that's an animal-derived food.
Great. Thank you for that. I know it is a hot topic that you're seeing a lot of coverage on lately. I'm going to try and get 1 or 2 more questions in here for us. What would Dr. Taylor recommend for women who have already gone through menopause, who've been diagnosed with osteoporosis? Is there anything that can be done at this point to improve the condition?
Oh, absolutely. And this is one of those things where, look, I have a background as the chief scientist at the National Osteoporosis Foundation. I am not a physician, but I do know per that position that there are several medical treatments and that it's all an individualized approach. There are things like terapeptide that can help grow new bone if it's right for you. From a nutrition standpoint, dairy, dairy, dairy. That systematic review we did on dairy, what we found is that in the above 50 population, whether you were male or female, if you wanted to prevent bone loss from happening even further, you better get your 3 servings of dairy. The other thing that I think is probably really important is, again, the potassium, magnesium, fruit and vegetable regimen, you know, for that. And the National Osteoporosis Foundation has recommendations specific for patients with osteoporosis on their website at nof.org. And I usually blog about that kind of stuff as well. So there's a lot of resources on my site about that. But from a nutrition perspective, dairy intake, and then weight bearing and resistance exercises.
Fantastic. Thanks so much. We are at time today, but I wanted to thank you, Dr. Wallace, for this great information, as well as our attendees. Nearly everyone stayed on the entire time and we're highly engaged with questions. So I know this is an important topic. As I mentioned earlier, it feels like sometimes we take bone health for granted, but I'm thrilled to see the level of interest from our attendees here today. And you can all gain more information either by visiting Dr. Taylor Wallace's site or by visiting usdairy.com. Thanks so much.